A bill in the legislature right now might lower your health care prices by 15%. At least that's according to an economist who supports it. News 8's government reporter Garrett Berquist explains how it would work.
This is a priority for House Republicans. It comes about a year after they demanded Indiana's largest hospital chains lower their prices. But the hospitals say the bill will only worsen the very problem it's meant to solve. Most doctors at your local hospital can't work for another practice across town. That's because of non-compete clauses. Dr. Ron Panicki says he ran into those when he opened a new surgical center in Boone County.
One of them actually hired a lawyer to review the contract and attempted to get permission from the hospital system on their off time, on their vacation weeks, on the times when they weren't otherwise providing clinical services under their employment contract to actually provide clinical services at Wellbridge, and they were told no, quite emphatically.
Supporters of a new health care bill say that hurts competition and drives up the costs you pay. The measure would ban non-compete clauses for doctors and require hospitals to report the average price they charge for each service. Ball State economist Michael Hicks says this could cut consumer costs by 15% over 4 years. But the hospitals take issue with a provision that fines them if they charge more than the national average Medicare reimbursement rate.
Medicare does not grow their set price at the same rate as inflation. This is the definition of unsustainability. House Bill 1004 would penalize the fifth or one of the lowest cost healthcare system to the tune of $30 million.
They say lawmakers would be better off working with them and the medical industry to find ways to bring down costs. Bill sponsor Donna Shively says the hospitals already have had their chance.
They didn't respond. We did have a response from IU Health, and were working to freeze their prices for a number of years to bring it down to and they thought at that point they would be at the national average, but the other hospitals really did not give a response. It was more just kind of word salad.
The House Public Health Committee did not vote on the bill. The chair says there likely will be some changes based on Tuesday's testimony. At the State House, Garrett Bergquist, Wish TV, wishtv.com, and follow us on Facebook.
A rally at the State House today for better health care access in rural communities. The group Hoosiers for Health Care Access says more than 2.4 million people in Indiana lack access to basic primary health services. That's an increase of 14% in just the last year. The coalition says Indiana must do better.
When patients don't have access to primary care, mental health care, maternity care, they end up in the hospital, in the emergency rooms with really poor health outcomes when you're trying to take care of something that's a little bit too late.
The coalition is calling on state lawmakers to pass 2 bills. They say that would remove regulatory roadblocks, restricting patient access to advanced practice, registered nurses, and increase health access to basic primary care.